What's happening in your body? As estrogen levels fall, the brain's thermostat becomes more sensitive, triggering hot flashes and night sweats. Muscle mass and bone density also decline, while fat redistributes toward the abdomen. Understanding this biology guides the treatments that actually work. Reduce temperature surges, protect bones and muscles, and improve sleep quality. Hormone therapy, HRT, is the gold standard for hot flashes and night sweats. For healthy women who are under 60 or within 10 years of their last period, the benefits often outweigh the risks when therapy is individualized. Estrogen relieves vasomotor symptoms and helps preserve bone. If you still have a uterus, a progesterone is added to protect the uterine lining. Many clinicians favor transdermal estradiol, patch, gel, or spray, at the lowest effective dose because it avoids first-pass liver metabolism and may be gentler for some risk profiles. Discuss route and dose with your clinician. Who should avoid or modify HRT? Do not start HRT without specialist input if you have a history of estrogen-sensitive breast cancer, unexplained vaginal bleeding, prior blood clots, stroke, heart attack, or severe liver disease. A careful review of your personal and family history, blood pressure, migraine pattern, and medications helps tailor a safe plan. Sometimes a very low dose or a different route is appropriate, and sometimes non-hormonal therapy is the better choice. Non-hormonal medicines that truly help. If HRT isn't for you, several prescription options reduce hot flashes within weeks. Select SSRIs or SNRIs, such as escitalopram or venlafaxine, can lower hot flash frequency and improve mood. Gabapentin may help especially with nighttime symptoms. Oxybutynin can reduce flushing for some. A newer non-hormonal class that targets heat regulation pathways in the brain, NK3 receptor antagonists, is another option your clinician may consider. These aren't one-size-fits-all. Your medical history and side effect profile will steer the choice. Sleep fixes that actually work. Treating hot flashes often improves sleep, but layering in simple cognitive behavioral therapy for insomnia, CBTI, strategies makes a big difference. Keep a fixed wake time, use a 30-60-minute wind-down routine, cool your bedroom, 16 to 19 degrees C, 60 to 67 degrees, limit caffeine and alcohol after mid-afternoon, and reserve the bed for sleep. If you wake at night, avoid screens. Do a brief relaxation or breathing set, and return to bed only when sleepy. If snoring, witnessed apneas, or restless legs are present, ask about sleep apnea or iron testing. Treating these pays major dividends. Weight and the menobelly myth versus reality. Menopause shifts body composition toward less muscle and more abdominal fat. HRT is not a weight loss medication, though it may blunt some central fat gain in certain women. The foundation is lifestyle. Aim for 1 to 2 palm-sized servings of protein per meal: eggs, Greek yogurt, tofu, fish, legumes. Add resistance training 2 to 3 days per week, body weight, bands, or light dumbbells, and move daily with a realistic step goal. Better sleep and stress management lower cravings and support muscle retention, which raises metabolic health more than scale weight alone. Safety first. Quality matters. Prefer regulated, body-identical formulations, 17-Vru estradiol and micronized progesterone, in approved products rather than custom compounded hormones, which can vary in potency and purity. Reassess your plan at least annually. Confirm symptom control, check blood pressure and breast screening status, revisit bone health, and decide whether to continue, pause, or taper the dose. The guiding principle is the lowest effective dose for the shortest time that meets your goals, while recognizing that some women benefit from longer use with regular review. A simple decision path you can take to your doctor. If hot flashes, night sweats are your main problem, and you're within 10 years of menopause without major contraindications, discuss HRT first. Consider a transdermal estradiol plus progesterone regimen if you have a uterus. If HRT isn't right for you, ask about evidence-based non-hormonal options and choose based on your symptoms, daytime versus nighttime, mood needs, and medical history. If sleep is still rough, add CBTI habits and evaluate for sleep apnea. If weight is the concern, prioritize muscle, protein each meal, 2 to 3 resistance sessions weekly, steady steps, and consistent sleep. Putting it all together for 2025. Menopause isn't a test of willpower. It's physiology you can manage. Combine targeted symptom relief, HRT or non-hormonal medication, with sleep upgrades and a muscle-first lifestyle to restore energy, mood, and confidence. Track 2 or 3 metrics that matter to you: night sweats per week, nights slept through, or strength gains, and adjust the plan with your clinician every few months. Takeaway you can act on today. Book a menopause-focused visit with your clinician, list your top 3 symptoms, and bring this article as your roadmap. Ask about the safest route and dose if trying HRT. Request a non-hormonal option if you prefer to avoid hormones, and start a 10-minute evening wind-down plus 2 brief strength sessions this week. Small, consistent steps add up to big wins: stronger bones, steadier sleep, and a calmer, cooler you.